Let's talk about the counselor's responsibility in record keeping. Maintaining client notes has a dual purpose. The first one is to provide the best service possible for clients. Are they meeting their treatment goals? Are they progressing? How will you be able to determine that if you're not keeping notes? It's also a way to provide a basis for safeguarding the counselors in the event of a lawsuit. Document your decisions and actions and everything that you've done while working with this client. Many counselors would rather spend their time with clients instead of documenting, but you can do both. Your chapter wants you to be familiar with the difference between progress notes and process notes. A progress note means a way of documenting aspects of a client's treatment and are kept in a client's clinical record. They are behavioral in nature and address what people say and do. A process note, on the other hand, or a psychotherapy note, are intimate details about the client, sensitive information about their personal life, and the counselor's own thoughts and feelings and reactions to the client. Process notes are not meant to be readily shared with others. Keep in mind that the law requires progress notes on all clients, but not process notes. A client's clinical record is not the place for a counselor's personal opinions or personal reactions to the client. It should always reflect professionalism. Keeping records is not a voluntary task. It's an ethical, clinical, and legal requirement. Your chapter talks about one of the really important things about keeping client records has to do with malpractice suits or other difficult situations. And we're going to review a few of those. For example, what if you're working with a violent or aggressive client? You need to document your actions in a crisis situation. What happened that led up to the situation? What kind of strategies did you attempt or do in order to deal with the situation? A few years ago, I had a counselor tell me that she was sitting in a session with a client who was suicidal. Right in the middle of the session, the client pulls out a gun. Of course, you don't see this coming. She was able to talk the gun away from the client, who got up and ran out of the session. She eventually called the police. But this would be an example of where everything that she did should be documented. Competent record keeping is one of the most effective tools for counselors to successfully respond to licensing board complaints or threats of malpractice suits. Case notes should never be altered or tampered with after they've been put in the client's clinical file. Enter notes as soon as possible after the session and sign and date the entry. On page 191 in your text, it talks about the content areas for inclusion in record keeping. Take the time to review that. It's really important. If it's not documented, it did not happen. Never forget that. Oftentimes, counselors have said they don't want to keep notes because they're concerned about violating confidentiality. I've had counselors tell me, what do I do if my client's records are subpoenas? Maybe in a custody fight or domestic fight or a divorce. I don't want to keep records because if it's not there, then I don't have to testify against my client. They don't want to assume a legalistic stance in their counseling practice. Or, and this is the big one, they don't have enough time to keep notes. None of these are excuses for not keeping adequate documentation. Your chapter also provides some guidance on how do you document when you're working with couples, families, and groups. In order to protect confidentiality, it may be useful to keep a separate record for each person participating in group therapy. However, if you're doing couples counseling and the couple is considered the client, Then you can keep one record. Keep in mind that records can be audited at any time by your managed care system, and they may demand a refund for services rendered if the records don't contain a complete description of all the services rendered. If you say, for example, that you met with a client and have no record on that day that you met with them, you might have to pay back for that session. Your chapter also goes into how to handle difficult situations like record keeping for school counselors. For example, it may be difficult to keep a record on every individual since the ratio of client to counselors is often like 400 to 1. The ethical standards for school counselors says, maintain and secure records necessary for rendering professional services to the student as required by law, regulations, institutional procedures, and confidentiality guidelines. Keep records of individual student case notes separate from student educational records. Think about this for a minute. If you've got their individual therapeutic issues thrown in with their school records, who gets to see that? Every teacher that they get from then on out. That could make them judgmental, could perpetuate biases, and it breaks confidentiality. Keep sole possession of records or individual student case notes separate. Securing records now and in the future. Client records must be handled confidentially. Store records in a secure place. This could be a licensure issue for some facilities. Be aware of technology as a storage tool, for example, the cloud or cyber criminals. Encrypting data reduces this risk. Remember that clients can request a copy of their records at any time. Counselors are ethically and legally required to keep records in a secure manner and to protect client confidentiality. How long do we keep them? Well, many of the states differ. For example, in our state right now it says keep your records for 7 years. However, your text suggests to keep the records 10 years after termination. For minors, 10 years after a minor has turned 21. There are a lot of ethical issues come into light as a result of online counseling. Emails, video chat, apps. How are we going to protect confidentiality? Is it really a positive therapeutic process to do counseling via these different mediums? Look at your ACA 2014 Code of Ethics and see what it says. There are some emerging issues coming to light with online counseling. For example, how valuable is it for clients with psychological distress, such as suicide or homicidal intent? You're missing those cues, those nonverbal cues, when you're meeting with the client. You won't get that over the internet. What about duty to protect when the client discloses threats of harm to self or others? Over the email. What happens if you have a suicidal or homicidal client and you don't know where they are or how to locate them in the case of an emergency? Your chapter says there are some advantages and disadvantages of online counseling. Some of the advantages include online counseling may enable men to feel less constrained by those masculine stereotypes. In other words, they might, because of anonymity, be able to express their emotions more freely. Greater number of people can receive services, especially in the rural areas. Or what about clients who are immobile because of disabilities or illnesses and wouldn't be able to get up and come into a person's office? Remember that online counseling is not necessarily appropriate for every client. Make sure that the behaviors outweigh the risks. Some of the disadvantages included what we talked about earlier, no behavioral clues. You can't read nonverbal body language. This can sometimes provide an inaccurate diagnosis. We can't guarantee confidentiality and privacy. What about duty to warn? That might be limited. As we talked about earlier, suicidal, suffering extreme anxiety or depression may not receive adequate attention. Online providers can misrepresent themselves in their qualifications, and clients can misrepresent themselves. It's really difficult to deal with transference and countertransference when you're not there in person. It may be difficult to establish a therapeutic alliance also. Right now, we don't have enough data to determine the effectiveness of online counseling, but remember, benefits should outweigh the risks. Your chapter mentions some legal issues for online counseling. For example, can someone in one state do treatment with someone in another state? There are a lack of studies at this time to prove that online counseling is less effective than face-to-face or more effective. Clinicians must be competent and comfortable with this form of counseling. There's nothing worse than a clinician interrupting a therapeutic session to deal with technology. You may require special training in this situation. Your chapter talks about counseling children and adolescents and how informed consent affects them. Counselors should discuss the limits of confidentiality with their minor clients. Be familiar with your state laws. Each state has specific statutes and regulations that offer guidelines to clinicians working with children and adolescents. In most states, parental informed consent or being court-ordered is necessary in order to work with children and adolescents. As a general rule, parents are entitled to general information from the counselor about their child's progress in counseling. FYI, for your information, in Idaho, an adolescent can check themselves into treatment for substance abuse at the age of 16 without parental consent. For a minor to enter into a counseling relationship, it's necessary to have informed parental or guardian consent, and as previously mentioned, or being court-ordered into counseling or treatment. Here are some of the exceptions to having parental consent. If a minor is seeking counseling for drugs, for sexually transmitted diseases, pregnancy and birth control, or examination following alleged sexual assault of a minor 12 years of age. Keep in mind that if you are seeing a minor that fall into one of these exceptions, so they don't have parental consent, you have to make sure that the child is competent and knows what the process is for treatment and knows what they're getting into. What are some of the risks of treatment? If you don't help them, what might they do? How serious is the problem? Some other exceptions. Did you know that the law protects the right of certain adolescent populations to seek counseling without parental consent? I didn't know about this. Some of these exceptions are immigrant families, kids that live in immigrant families, or homeless kids, gay and lesbian youth, or those who have cultural backgrounds that don't condone counseling.